the word that turns a routine doctor's appointment into a before and after moment in someone's life. It is not one disease. It is not even 10 diseases. It is over 200 distinct biological rebellions, each with its own logic, its own weapons, and its own particular way of making your body betray itself. What follows is every major type, explained without softening, without false hope, and without the pamphlet language that helps nobody. Lung cancer. The deadliest cancer on the planet, and most people still picture it as something that only happens to smokers who made bad choices. Wrong. 20% of lung cancer deaths occur in people who never smoked a single cigarette in their lives. That number deserves a moment of silence. The lung has been filtering air since the first breath you took. Every toxin, every particle, every microscopic insult to the bronchial lining has been quietly accumulating since birth. Radon gas seeps through the floors of ordinary homes. Air pollution fills lungs in cities that look perfectly clean. And yes, cigarette smoke, which contains over 7,000 chemicals, at least 70 of which are confirmed carcinogens, remains the leading cause. Here's what happens inside. A cell in the bronchial lining accumulates enough DNA mutations to stop following orders. It stops dying when it should die. It starts dividing when it should rest. Two types dominate: non-small cell lung cancer, which grows slowly and accounts for 85% of cases, and small cell lung cancer, which grows with horrifying speed and spreads before most people even develop symptoms. Here's the part nobody tells you. Lung cancer produces almost no symptoms until it is dangerously advanced. No pain, no coughing up blood, no obvious warning. By the time most people are diagnosed, the cancer has already reached lymph nodes or distant organs. The 5-year survival rate for late-stage lung cancer is around 7%. Early detection through low-dose CT scans could change that number dramatically, and remains criminally underused. Over 1.8 million people die from lung cancer every year. It kills more people than breast, colon, and prostate cancer combined. Breast cancer. The pink ribbon made it famous. The awareness campaigns made it feel managed, survivable, almost tidy. The reality is considerably less tidy. Breast tissue has been subject to hormonal cycling since puberty, a relentless rhythm of growth, differentiation, and regression driven by estrogen and progesterone. Each cycle is an opportunity for error. Each error is a mutation. Each mutation is a lottery ticket in the wrong direction. The breast contains several distinct cell types: ductal cells lining the milk ducts, lobular cells in the glands, and supporting stromal tissue. Most cancers start in the ducts, ductal carcinoma in situ, which is contained, versus invasive ductal carcinoma, which is broken through and is looking for somewhere to go. The HER2 protein, when overexpressed, acts like a stuck accelerator on a car with no brakes, driving uncontrolled growth at extraordinary speed. Here's the part nobody tells you. Breast cancer is not one disease. It is at least 4 molecularly distinct subtypes: luminal A, luminal B, HER2 enriched, and triple negative. Triple negative breast cancer, which lacks estrogen receptors, progesterone receptors, and HER2, does not respond to hormonal therapy or HER2-targeted drugs. It is aggressive, it disproportionately affects younger women and black women, and it has fewer treatment options than a disease that kills as many people deserves. 2.3 million new cases are diagnosed globally every year. Breast cancer is now the most commonly diagnosed cancer in the world. Colorectal cancer. Nobody wants to talk about it. That silence is precisely why it kills so many people. The colon is a 5-foot tube responsible for extracting water and electrolytes from digested food. It is also, over a lifetime, subject to a slow accumulation of cellular damage from diet, inflammation, bacteria, and genetics. The average colon sees your entire diet pass through it, every processed food, every charred meat, every fiber-deficient meal, for decades. Most colorectal cancers begin as polyps, small, benign growths on the inner lining of the colon or rectum. A polyp is not cancer. A polyp, left alone for 10 to 15 years, often becomes cancer. The adenoma to carcinoma sequence is one of the most well-documented cancer progressions in medicine. It is also one of the most preventable. Here's what nobody mentions. Colorectal cancer is rising dramatically in adults under 50. A person born in 1990 has double the risk of colon cancer and 4 times the risk of rectal cancer compared to someone born in 1950. Nobody has a definitive explanation. Processed food consumption, microbiome disruption, sedentary behavior, antibiotic overuse, all plausible, none conclusive. Meanwhile, colonoscopy screening, which can find and remove precancerous polyps before they become tumors, is avoided by millions of people because it is uncomfortable and undignified. Colorectal cancer is the second leading cause of cancer death in the United States. A significant portion of those deaths were preventable with a single procedure. Prostate cancer. The cancer most men have heard of, think they understand, and badly misunderstand. The prostate is a walnut-sized gland sitting just below the bladder in men, responsible for producing seminal fluid. It is exquisitely sensitive to testosterone. It is also prone to growing slowly, quietly, and without permission as men age. By age 80, roughly 80% of men have some cancerous cells in their prostate. Most of them will die with it, not from it. Prostate cancer exists on a vast spectrum. Gleason score 6 tumors are so slow-growing that active surveillance, essentially watching and waiting, is the recommended approach for many patients. Gleason score 9 or 10 tumors are aggressive, treatment-resistant, and lethal. The PSA blood test measures prostate-specific antigen and is used for screening, but it has a notoriously high false positive rate and has led to millions of men being overtreated for cancers that would never have harmed them. Here's the part nobody tells you. The treatments for prostate cancer, radical prostatectomy and radiation, carry significant rates of permanent incontinence and erectile dysfunction. Men are often not told clearly enough that they're slow-growing. Low-risk tumor may cause less harm untreated than treated. Shared decision-making in prostate cancer is a polite phrase for a situation where the patient frequently doesn't have enough information to make the decision they're being asked to make. 1.4 million cases are diagnosed yearly. The mortality gap between black men and white men with prostate cancer in the United States is one of the largest racial disparities in all of oncology. Skin cancer. The most common cancer in the world. Also, the one people treat as optional to prevent. The skin is the body's largest organ, logging every UV photon that has ever hit it since the first day you were taken outside. Ultraviolet B radiation strikes DNA in keratinocytes and melanocytes and causes a specific, identifiable mutation, cytosine to thymine substitutions, that is so characteristic of sun damage that pathologists can look at a mutation pattern and know exactly what caused it. 3 types dominate. Basal cell carcinoma, slow, local, almost never fatal. Squamous cell carcinoma, more aggressive, capable of spreading if ignored. Melanoma, the dangerous one. Melanoma accounts for only 1% of skin cancer cases and the vast majority of skin cancer deaths. It begins in melanocytes of pigment-producing cells and has an exceptional ability to metastasize early to lymph nodes, lungs, brain, and liver. Here's what nobody mentions. Melanoma can appear in places the sun has never touched. Inside the mouth, under fingernails, on the soles of feet, in the eye, in the GI tract. Acral lentiginous melanoma, the subtype most common in people with darker skin, appears on palms and soles and is frequently diagnosed late because nobody thinks to look there. Bob Marley died of acral lentiginous melanoma. He was 36. More than 1.5 million new melanoma cases are diagnosed each year. Tanning beds increase melanoma risk by 75%. They remain legal in most countries. Leukemia. Cancer of the blood itself, which means the very system designed to protect you becomes the threat. Blood is produced in the bone marrow through a process called hematopoiesis, stem cells differentiating into the full spectrum of blood cell types. It is a high-throughput, high-error rate operation. Over 1 trillion blood cells are produced every single day. Each one requires precise genetic regulation. When that regulation breaks down, you get leukemia. 4 main types exist. Acute lymphoblastic leukemia, primarily a disease of children, and one of the great success stories of oncology with survival rates over 90% in pediatric cases. Acute myeloid leukemia, fast-moving, aggressive, and with far grimmer outcomes in adults. Chronic lymphocytic leukemia, slow-growing, often discovered incidentally, sometimes never treated. Chronic myeloid leukemia, the cancer that changed oncology forever when imatinib, the first targeted molecular therapy, turned a death sentence into a manageable chronic condition. Here's the part nobody tells you. Leukemia is not one of those diseases where you feel visibly sick and dramatic. In many chronic forms, the first symptom is a blood test result that looks slightly off. The cancer has been developing for years before anyone noticed. Also, cancer treatment itself causes leukemia. Secondary leukemia from chemotherapy and radiation is a documented, tragically ironic consequence of surviving another cancer. Roughly 500,000 new cases are diagnosed globally each year. Brain cancer, the one that changes who you are before it changes how you feel. The brain is immunologically privileged, meaning the blood-brain barrier restricts immune surveillance, which sounds protective until you realize it also means tumors hiding in brain tissue have an unusually good shelter from the immune system. Primary brain cancers originate in the brain itself. Secondary brain cancer metastases are far more common and arrive from cancers elsewhere in the body. Glioblastoma multiforme is the most common and most lethal primary brain tumor. It is a grade 4 astrocytoma, meaning it grows from supportive brain cells called astrocytes and earns the highest malignancy score. It does not respect anatomical boundaries. It sends tentacles through white matter. It cannot be fully resected because cutting it out means cutting out functional brain. Median survival after diagnosis is 15 months. That statistic has barely moved in 30 years. Here's what nobody tells you. Brain tumors don't just kill. They alter personality, strip language, erase memories, and change who a person is while they are still alive and technically present. Families lose the person before they lose the body. Also, cell phone radiation, despite decades of fear and headlines, has not been conclusively linked to brain cancer. The actual risk factors for glioblastoma remain largely unknown, which means there is no meaningful prevention strategy. This is deeply uncomfortable for a field that usually has at least a lifestyle recommendation to offer. Pancreatic cancer. If oncologists had to choose the diagnosis they feared most for themselves, many would choose this one. The pancreas is a dual-function organ sitting behind the stomach, producing digestive enzymes into the small intestine and secreting insulin and glucagon directly into the bloodstream. It is tucked away, inaccessible, symptomless in its dysfunction, and surrounded by major blood vessels that make surgery extraordinarily difficult. Pancreatic ductal adenocarcinoma accounts for 90% of cases. It begins in the cells lining the pancreatic ducts and grows silently for years before causing any detectable symptom. When symptoms do appear, jaundice, back pain, unexplained weight loss, new-onset diabetes in an older adult. The tumor is usually already locally advanced or metastatic. Here's the part nobody tells you. The 5-year survival rate for pancreatic cancer is 11%. For metastatic disease, it is 3%. The pancreas lacks a reliable early detection biomarker. CA19-9, the blood marker sometimes used, is elevated in many other conditions and misses a significant proportion of early cancers. Surgery, the Whipple procedure, is one of the most technically demanding operations in all of medicine and is only possible in the minority of patients diagnosed before the cancer spreads. Steve Jobs had pancreatic cancer. He had the rare survivable neuroendocrine subtype. Most people do not have that subtype. Over 400,000 people die from pancreatic cancer every year. Cervical cancer. One of the only cancers in history with a known cause, a known prevention, and a vaccine. And it still kills 340,000 women per year. The cervix is the lower portion of the uterus, connecting it to the vaginal canal. It is lined with squamous cells that are unusually vulnerable to infection by human papillomavirus, HPV, a sexually transmitted virus so common that most sexually active adults will contract at least one strain in their lifetime. Most HPV infections clear on their own. High-risk strains, particularly HPV-16 and HPV-18, can persist, integrate into cervical cell DNA, and drive malignant transformation over a period of 10 to 15 years. This is a cancer that announces itself in advance. Cervical dysplasia, abnormal cell changes visible on a pap smear, precedes invasive cancer by years. The entire disease course from initial HPV infection to invasive cancer is long enough to be interrupted at multiple points. Here's what nobody mentions. The HPV vaccine, which prevents infection with the strains responsible for 70% of cervical cancers, is available, effective, and being refused or underfunded at rates that are difficult to comprehend given stakes. Countries with robust vaccination and screening programs have seen cervical cancer rates collapse. Countries without them haven't. This is not a mystery of science. It is a failure of public health infrastructure and, in some cases, political will. Cervical cancer is almost entirely a disease of inequity. The women who die from it are almost always women who could not access prevention. Thyroid cancer. The cancer with the best survival rates, the fastest rising incidence, and the most controversial diagnosis in modern oncology. The thyroid is a butterfly-shaped gland at the base of the throat, producing hormones that regulate metabolism, heart rate, and body temperature. It is one of the most surveilled organs in modern medicine. Ultrasounds, blood tests, incidental findings on CT scans ordered for entirely different reasons. 4 types exist. Papillary thyroid cancer is by far the most common, accounting for 85% of cases. It is slow, it is highly treatable, and its survival rate approaches 100% in localized cases. Follicular thyroid cancer is slightly more aggressive, but still very manageable. Medullary thyroid cancer is rarer and tied to a genetic syndrome, MEN2. Anaplastic thyroid cancer is the outlier, one of the most aggressive cancers in all of oncology, with a median survival measured in months. Here's the part nobody tells you. A significant portion of papillary thyroid cancer diagnoses may represent overdiagnosis. The detection of small tumors that would never have caused symptoms shorten life or require treatment if left undiscovered. South Korea launched an aggressive thyroid cancer screening program in the 1990s. Incidence exploded. Mortality did not change. The tumors being found were not the tumors that were killing people. Medicine then faced the uncomfortable task of telling patients their cancer did not need to be treated, after surgery had already been performed. The rising incidence of thyroid cancer is partly a rise in disease and partly a rise in our ability to find things we were perhaps better off not finding. Lymphoma. Cancer of the lymphatic system, the network of nodes, vessels, and immune cells that functions as the body's secondary circulatory system and first line of immunological defense. The lymphatic system runs everywhere. Lymph nodes cluster in the neck, armpits, groin, chest, and abdomen. When lymphocytes, the white blood cells that operate in the system, undergo malignant transformation, they can proliferate at any node in the network and spread through the same channels designed to carry immune protection. 2 broad categories. Hodgkin lymphoma, defined by the presence of Reed-Sternberg cells, enormous, distinctive cells visible under a microscope that look like nothing else in pathology. It is one of the most treatable cancers in medicine. Non-Hodgkin lymphoma is an umbrella term for over 60 distinct subtypes ranging from indolent and watchable to aggressive and rapidly fatal. Diffuse large B-cell lymphoma is the most common aggressive type. Follicular lymphoma is the most common indolent type. Here's what nobody tells you. Lymphoma frequently masquerades as other conditions. Swollen lymph nodes are caused by infections far more often than cancer. Night sweats, fatigue, and unexplained weight loss, the classic B symptoms of lymphoma, are also symptoms of approximately 100 other things. The diagnostic delay in lymphoma is real and frustrating. Also, HIV infection dramatically increases the risk of certain lymphomas, and immunosuppression from organ transplantation does too. The immune system, when compromised in specific ways, loses its ability to keep abnormal lymphocytes in check. There are over 500,000 new lymphoma diagnoses worldwide every year. Cancer is not one enemy. It is 200 enemies wearing the same name. Some are slow, some are swift, some are preventable, some are random. Some respond to treatment with extraordinary grace. Some respond to nothing we currently have. The common thread is this: cells that should cooperate decided to defect. And the body, the most sophisticated self-repair system in the known universe, did not catch in time. Research continues. Treatments improve. Survival rates for many cancers look nothing like they did 20 years ago. The work is not done. The 200 enemies are still out there, and most of them are not waiting.